Welcome to Power Hour. We're thrilled to have you all today, and we're especially thrilled to have Dr. Madison Burrell from Children's National Hospital in DC to talk to us about using neuropsychological evaluation to inform your child's transition plan. Take it away, Dr. Burrell. Thank you.
Yeah, good to be here. Thank you for inviting me. I also just want to disclose I'm a mom. So I know that many people that sign up are parents and caregivers. And so please ask me as a fellow mom that any question will do. And please interrupt me if I'm saying something that isn't clear. Sometimes I get in my own jargon and I'm happy to clarify. So please interrupt. This is for you and your information. My plan really is to start more general. My thing is not advancing. Let's see. You have,
Try going down to the bottom left, and there might be a place where there are buttons show up.
there we
There you
go.
go.
Got
Yeah,
it.
when you're
Thank
on
you.
Zoom, sometimes it
Got
does
it.
not. Yeah.
Awesome. So there's a lot to cover, but I want my goal is to hit a lot of things, maybe a little bit more broadly, with a couple of nice nuggets in between. But again, like if you have a more specific question, you can either wait till the end or interrupt me. It's fine. So my main topics here is just make sure we all understand what a transition plan is, and also talk about neuropsychological evaluation and what that is and how it's helpful in your transition plan, in terms of when should you fold that in, and then again just a few things where if I had to say, if you go home with this is what I want you to remember. And Audrey, you're going to tell me if in the chat there's anything I need to know because I'm not reading that.
Yes,
So
I'll keep you updated. Anyone can put any questions in the chat, and if there's something that I think is needed during the presentation, I'll interrupt Dr. Burrell. Otherwise, we'll have time at the end for Q&A.
perfect. So really the guiding principle here is that, if your child is doing great, you're going to deal with the same problems that any parent does when their kid is transitioning, and that's not easy. But assuming that there's a fair amount of kids with epilepsy or who have been treated for their epilepsy, and they are dealing with some sort of intellectual and developmental disabilities, is my premise here. That's why you need a transition plan. You don't get a transition plan unless you've had an IEP. So, an individualized education plan, which gives you special education services at school. So that's one assumption I'm going with here. And because of that, really what we're talking about here is that all of our kids with IDD have the right to recognition as a person before the law and to enjoy legal capacity on an equal basis with individuals who do not have disabilities in all aspects of their life. And so this is the idea of that even our kids with IDD have these same, again, sort of rights to live life and enjoy it and have access. And so just keeping that in mind. I am making a little bit of an assumption that you may have heard along the way that about neuropsychological outcomes of children with epilepsy. But I want to sort of give you a little bit of a summary slide and some highlights. The truth is outcomes really vary from really no impairment. We have children who are gifted. One of our Supreme Court judges, has had seizures, to very severely impaired people that are nonverbal and are fully dependent on others. So the outcomes really vary, and they do vary by epilepsy type, but even within the same kind of epilepsy, there is a lot of variability as well. So again, data show that these impairments are evident early And when they are evident, they're evident early and persist throughout life. Because remember, epilepsy is a childhood onset disorder. So most people with epilepsy have had it for a long time. The things that are associated with better functioning is stopping those seizures and reducing medications. That is shown over and over again, and even some improvements over time. The timeline of your development of skills is protracted. That means you need to allow more time to learn. And sort of this is what that shows here in this figure to the left, is that you have sort of typically developing kids in the blue line and over life, and you can see the ages from 0 to 90 here. So this is lifelong. And kids that have epilepsy, in this case, it's temporal lobe epilepsy, they may start off okay, but there's maybe a little bit of a widening gap. But again, they're gaining skills, but sort of that early and that impairment is really evident mostly in childhood, and then they go along the same track. There's no further decline after that. Once they sort of are different, they usually stay different. Obviously, there's some individual differences, but that's what that's about. So again, this is just kind of an indication of their ability to learn verbal information. So I thought that was a sort of snapshot of the kinds of trajectories that many of our IDD kids have. I do want to mention, though, that interventions do help, and we have some long-term evidence to suggest that. So the best evidence is from our friends in England and Canada, who are able to follow kids through their national health systems. And what you can see here, this is a lot of data, but I want to point out a few things. And these are two different studies. The first study up here is from England. And in the white bars, you have pre-surgical, or you have controls that did not have surgery. There are people that have epilepsy, but they have not had surgery. And you can see these are IQ scores. So anything below 80 here is below average. And then you have an average range, and then you have these people that are doing really well. And again, you kind of see the range that I was talking about before in ability, but it shifted in those people that did not have surgery versus the people that had surgery at long-term follow-up. So you see more people in the average range in that dark line, which is those people that have surgery. So you do have a shifting of abilities back to more normal functioning. And this is often what we see in normal populations. You have some people that are low, some people that are really high, but most of us are kind of in the middle here. And so that really is nice evidence to show that having surgery makes a difference in outcomes. And that's really important. The other thing about this that you can see down here is this is an indication of the percentage of kids that really changed a significant amount. And it's really not that much until 4 to 6 years after surgery. So it takes time to see this shift. And so if you're looking at functioning or trying to guess what's going to happen after surgery after 1 year, 2 years, maybe even 4 years, you may not be seeing the full effects of that positive impact on their thinking skills until several years later. And that's really important to know and understand about your child's brain and what happens when you intervene in some way to stop those seizures. This is on the lower one, it's the same kind of thing where the difference here are the kids that are seizure-free in blue and the kids that still have seizures at short-term follow-up. In the middle section, they even almost look like they go down. But if you look at long-term follow-up, you really see a difference and an improvement in those kids that are seizure-free. And that's across these thinking skills, both verbal, nonverbal, and working memory and processing speed skills. And so again, being seizure-free, having a reduction in medications, and allowing that follow-up to happen is when you start to see these changes. So how do we assess those things? One way is neuropsychological evaluation. And really what it is, it's done by a clinical psychologist typically. Some school psychologists have been trained and do have neuropsychological training, but you need to ask, and most do not. In fact, one person I trained with, she is a neuropsychologist in California for the Department of Education. I think she lives more in Fresno, and the area she has to cover is from like Ventura all the way up. So she has a huge swath that she's covering, and she is only seeing a small percentage of kids that the parents or the school system know that there's a child that has something like epilepsy or something usually neurological that needs a little bit more than the average assessment by the typical school psychologist. So that the key thing is who is doing it. A neuropsychologist is specifically trained to look at more than just an IQ test, but to look at memory and attention and understand how the brain interacts to understand a child's behavior and thinking skills. So it's a specialized skill, kind of like lots of doctors go to medical school, but you wouldn't want the brain doctor doing your heart surgery. It's the same thing with psychology. You don't want the neuropsychologist necessarily to be doing your therapy for a borderline bipolar kid, but you don't want that person to be doing your neuropsych eval. We have special training to do with special skills. So that's really important to know who does it. And they're not available at every school or even every county. So the timing of it, basically, once you know that there's something going on with your child, it's never too early to have a neuropsychological evaluation. And I do see young kids as young as 2 or 3 years old. Just like for any young kid, there may be less that you do because they're not able to do as much, but you can start to see patterns even at a very young age. And you start to see some of those delays. So we may be looking at motor function, and then obviously language function is the biggest thing that comes after that. And then we get into all the memory and the attention and, reading and all of those things. But we really, in order for us to be able to have the best sense about your child, we want to know what your child can do. So your child will serve as their own baseline. And so with changes that happen with treatment or over time, if you have a good baseline, even if there's maybe not too many problems at school or they're kind of hanging in there for first grade, that's all well and good. But if they've had a brain surgery before then, or you're thinking about going to brain surgery, it's really good to have the baseline. And most surgical teams are recommending that baseline evaluation before you would go to surgery. There are other times where you might consider waiting a little bit. Not that that's your first one, but there are times where I say, you know what, we can do this at 15 or 16. I know you're going to be transitioning and thinking about college and other things. There's different set of tests and a different set of norms that happen at age 16. So I may wait because you're going to get more out of it and you won't have to repeat it, because sometimes a college will say, no, we want this particular test. Or if you're sitting for the SATs or the ACTs, they're going to want the more adult versions of those tests in order to give accommodations. And so every once in a while, something like that comes on. That's pretty minor. I wouldn't worry about that so much, but it does come into play if you're deciding when, and you can always ask, like, is this the best time to do, or should I wait?
Can I interrupt with a question?
Sure.
So I was wondering if you're going to touch on how often to repeat neuropsychological evaluation. So let's say you do start at age 2 or age 10 or whatever age the child had surgery or the concerns arose. How often would you repeat it? And then along with that, there's a question in the chat about the timing of the neuropsychological evaluation in high school so that it's recognized by colleges. Does it vary? Is it by age or by year in high school? And if the child is considering a fifth year of high school, should they wait to time the evaluation for colleges? So I have an answer, but I would love to hear your thoughts
Yeah.
on this.
So it's really what you're using it for. So if you're really planning for college and you have an extra year in high school, I would wait, because you still have a year of high school to get to really understand what your child is going into for college. So it's not a set answer in terms of, and I think sort of my ultimately when it is needed is the answer, which is a hard answer. But the things I think about are demands. So when are demands going to be changing, and a transition time? A lot of times that's educationally, we have a period of time in first grade where your child is learning to read, and then their learning shifts where now they have to read in order to learn. That starts to happen at third grade, definitely by fifth grade. Another time where there's demand changes is you're going from elementary school where you have one teacher and more communication typically in elementary school, versus now you're going to a bigger school with middle school, junior high, whatever you call it, wherever you are. And now you have 7 teachers potentially, again, not always, depending on your child, if you're in a self-contained or not, but that's potentially a step up in demands, certainly for learning. And then another one is high school, where again, there's more to do, more demands, more independence for the things. And then again, then the last one would be for some kids, college or the workforce. And so those are, from a cognitive demand point of view, those are the time frames that I think about repeating. And that's why you sort of get this triennial every 3 years for the school, because it kind of maps onto that pretty well. Not always, but that usually every 2 to 3 years is kind of what I say. If your child has changed a lot though, because of treatment, or just whatever, coming in and out of COVID messed with, people's understanding of what was going on, then go in and see it. I would say most neuropsychologists would say if it's less than a year, let's do a consult first and talk about what's going on and whether we really need to do the full testing versus a check on some skill. And that is where having a relationship with that baseline family, I don't know if you think it's fair or not, but the families that I see more often, I'm going to fit them in for that consult and I can do it quickly and I know them, versus a family that's coming in, I don't know them. And so if you have that contact that, with your neuropsychologist, it's a lot easier for them to do the quick contacts back to say, to do the check and ask, is it a good time for testing now? The doctors often are the other ones that are asking me, I want to check this because I'm changing this treatment or I'm reducing medicines. We always do a baseline before surgery. We always do a 1-year follow-up after surgery. I hope that helps answer the question. The other things that a neuropsychological evaluation does is provide diagnoses. If you meet criteria, those are important because it informs treatments, both the IEP, the individual education plan at school, as what, services, accommodations, but also what you want to do privately. Where should you put your money? Where should you put your time? And also, other treatments like psychiatrists, psychologists, group therapy, those kinds of things. So a diagnosis is a shorthand for that. And then finally, it can bring eligibility for other programs. So there's often waivers based on whether you do or don't have an intellectual disability, or access to services, whether you do or don't have autism. So having that official diagnosis, which the schools don't always give, even though they may code them under autism, they may never, they're not diagnosticians and sometimes don't say that. And so, or it may not be accepted by the state program. And so that is helpful out of the neuropsych. The other thing that I think is really important is you're going to get recommendations based on the profile of what to do. And again, that covers all areas. It's home, it's school, it's future thinking. And because of that, it really needs to be strengths-based. So most people think, oh, they're just going to tell me all the things my kids aren't doing right. And I know that already. But you also want to find those things that the child can do. And sometimes the school doesn't see it. And that's the place you need to start for an effective intervention. And so if you don't know what your child can do, you don't know what's going to be the most helpful. And so it's really important to understand what those strengths are and how you can move from them to have great recommendations. All right, so let's move to a little bit to a transition plan. Some of this, you're more than welcome to have access to these if you like. And this is all information. So some of this I may not dive into, but I just wanted you to have the information. But basically, a transition plan is the purpose is to plan for your child's future by setting goals and deciding what supports and services are needed to help them be successful. It's federal law under the Individuals with Disabilities in Education Act that the students with disabilities, aka you have to have an IEP. A 504 doesn't really cut it to get a transition plan. You have to have an IEP. Are entitled to a free, appropriate public education designed to meet the child's unique needs and prepare them for further education, employment, and independent living. So this is supposed to prepare them for life. So if they don't have goals and they don't have a plan for that, they have not met the requirements under federal law. So there's key facts. All individuals are considered legal adults at age 18. Parents cannot act on their child's behalf, even in the case of well-substantiated developmental disability, without this legal paperwork. So just be aware of that as your child hits that 18 mark. I don't think they really let you do it until like 17 and a half. So it always feels, but you can get your papers ready of what you might need, but you can't really do much until then because they want a more close assessment to that. So again, when we're thinking about timing of things, sometimes if you're trying to figure out independence and ability to make these decisions, sometimes that 17 and a half mark is like a nice mark. It's not too, once they've turned 17, it's close enough to that 18 that you can use that evaluation and that in establishing whether they need some legal guardianship. Mental health and well-being are positively associated with self-determination among individuals with intellectual and developmental disabilities. I may be preaching to the choir here, but our kids are in many ways like anybody else. If they're part of their life and active and engaged, they're going to do better as long as it's at the level they can be engaged at, right? And so the same is true whether you have IDD or not. And so being a part of the process is really helpful and having them be a part of their life in the way that they can. We all benefit from help making decisions. So again, even your typical teenager at this, transitioning to adulthood needs help. So it goes both ways. Just because you do have a disability or don't have a disability, you need all of these things. And then just the warning, it is a process. I'll say that again later. The process is more intensive, and the options are long and complicated. So you need time and you need to give yourself time. So the fact that you're listening to this already is a good sign. You're already thinking about it. There's a spectrum of decision making. And as you can see by the arrows, the degree of autonomy or independence goes down on this list and the degree of support goes up. So those are in balance. If you need more help, you need more. If you're less independent, you need more support and vice versa. So guardianship would be the most sort of dependence and support, all the way down to just a simple release of information so that you can understand, what drug your kid is on or something like that. So, and just get the information when you need it, or when your child is having a seizure, right? So, if they're still having seizures. So we'll talk about each of these. And again, this is the lack of capacity, and we'll talk about capacity a little bit, is what is at stake with these 3 levels of decision making. And that's what a neuropsych evaluation can help you with, is whether they have capacity or not. What level of capacity. So the release of information, remember, that's the most less supported. It's a quick form to fill out. It grants access to that protected health information, educational records, medical records. It must be done for each relevant location. So if you're seen at the hospital, seen at the school, they each have their own. You have a psychologist, you have a psychiatrist. If they're not at the same place, it has to be done for each one. It's easy to modify. Usually they only last a year, and it's easy to revoke if your child says, no, I don't want my mom to have access. Next thing is supported decision making. So the individual identifies that group of people who will help them make decisions. This is a model. They must have some capacity to make decisions with help, and they've given consent, whether it's you or somebody else in the community or a psychologist or somebody else, to help them make their plan. Education people, the supporters help to ask questions, explain options, gather information, and communicate the decision. Even if you're at one of the higher levels of support, I still think this model of supported decision-making is helpful for you as a parent to keep in mind. Doing all of these things is what we wanted to, but doing it more overtly with your child rather than making decisions for them. You're probably so used to making the decisions, and we sort of forget as parents sometimes to transition with our child and allow them more choice. Talk openly and overtly about how you're thinking and where they can make a decision and have input. The individual retains their right to make decisions and must have capacity to do so, again, sort of on this lower level. It's a written plan and agreement, and it's often beneficial and easily modified. I would argue a supported decision-making is helpful for any child. I use some of the same tools to just help your child think through a decision. The representative payee is limited to government benefits. It designates an alternate person to receive and manage those benefits on the individual's behalf. So SSI payments, all that. Again, it's a quick form to fill out, but it's a different level of collecting the money. If your child has a lot of capacity in other areas, but money isn't one of them, this may be for you. Power of attorney, again, next level up, individual with IDD delegates another person to make those legal decisions on their behalf, and it's activated on condition of certain events or certain circumstances. For example, if their medical status changed, that kind of thing. Some of you might be familiar with this in other contexts with aging parents. It can be done without legal representation. A notary is needed. It's, again, easily revoked or modified. An individual must have the capacity to consent for this. And then again, stepping up, an authorized representative can include multiple types of representation in the healthcare setting, education, or disability services. The terminology may differ by state. So it could be called the substitute decision maker, like who can step in and actually make the decision. The individual is deemed incapable of making the decision for themselves in one or more areas. So again, maybe this is restricted to money, and that may be one area versus what they do in school or something like that. It requires medical assessments, but can be done without attorneys. And then conservatorship has been in the news with Brittany lately, but it's a legal determination that individual does not have capacity to manage those financial assets. It requires medical documentation, filing of paperwork, and going to court, working with attorneys. It's difficult to change or remove. And then lastly, guardianship, which is a legal determination that the individual does not have capacity to make their own decisions. There can be limitations to it, or it can be just for everything more general. It requires multiple assessments. We'll get more into that. Filing of paperwork, again, the process, and going to court, working with attorneys. It is, again, difficult to change or remove. So I won't go too much into those processes because I'm just going to loop it back to what a neuropsych can help you in deciding these different levels. I also want to point you to these resources. There's lots of resources out here, and in our time, we're not going to be able to answer everything. So resources are really helpful. There's national resources for just, learning more about supported decision making, having worksheets to kind of walk you through some checklists, things like that. There's the National Parent Center on Transition and Employment. There's several groups. So like, Pediatric Epilepsy Surgery Alliance has their own transition guide. The Autism Speaks has one. Organization for Autism has one. And they all have similarities, but maybe each has a little bit of a nugget that's helpful for you based on the disorder or other sources of resources or money or something like that that's maybe specific to their disorder. So sometimes these disease or condition specific guides can be helpful, and using the language you need to establish, capacity or things like that. So all of these are helpful. Think College is a wonderful and the only database that exists for looking at post-secondary programs for IDD. So several colleges, about 300 programs now, actually have an inclusive program to have a child with IDD attend their college. It's very supported. It's very contained. It does cost money. They often are eligible for money through FAFSA applications if you have need, things like that. But it's something to really think about. And even if your child is not going to graduate with a college degree, but there's pieces of what they do that they would benefit from a college experience. One example I can say is a child that actually has had great theater, aspirations, and they're, again, in the movie business or commercial business, there are some opportunities for different populations. And so that is what they were seeking, this family, when they were looking for a college that actually had a theater program that could maybe be helpful. And that was sort of an interesting way to think about things. Again, there's usually local resources because all of these decisions do vary by state. So I just put the ones that are near me, but I'm sure look them up for your state wherever you are. All right, considerations. How and when to exit high school is a big decision. I'm going to go into each of these a little bit, but some of the things you're thinking about are whether they're going to be on diploma track or a certificate track. I'm putting some stars for where a neuropsychological evaluation can really help you inform this decision and help with that. So diploma versus certificate, the timing of it. When should I go out of high school? Again, finances, I'm not going to go into these. I just want you to know there are all sorts of different accounts and trusts that we're going to want to be thinking about with finances that, help if you have other children, help your child. And then again, the FAFSA is open for certain programs that are approved to help you pay for a special needs program for post-secondary education. And you are FAFSA eligible. Again, readiness for what? What are we going to do here? What's after high school? And then how will you know? Again, all of these things a neuropsych eval can help you with. So how and when? So this idea of a diploma track versus a certificate certificate track is probably one everybody has to come up against this decision. And when you do, I think my general advice on this is don't make that decision before you're ready. If you know and you feel comfortable, that's fine. And sort of the case of a child who is nonverbal, maybe you're more aware of a certificate track than a diploma track. But other than that, and nonverbal, what I mean by that is like they don't use a communication device either. And their communication is very limited. That's going to be harder for them to stay on a diploma track, which is required to meet standards through statewide standardized assessments and completing the state curriculum. So if your child can't do algebra with some sort of accommodation, they may have a hard time in some states, and same with some reading standards are usually the two biggest ones, math and reading standards. A certificate track really is a certificate of completion or attendance, that they are not necessarily earning credits towards that diploma because they're unable to meet those requirements, but they are there and they are attending. Just be aware that if you're not on a diploma track, that's going to affect your employment opportunities later. Again, until you're really sure, I wouldn't agree to it. And I think I've seen too many families agree to a certificate track prematurely. And why I say that particularly with our epilepsy kids is because what I mentioned before at the top of the talk is that your child's brain needs more time. It's had an injury, it's having some treatments, and it is rewiring and reorganizing on a track that is different than normal. So if a child does not read, this is my hemispherectomy kiddo who could read before he went into his hemispherectomy, couldn't read, but it took him 6 more years after his hemispherectomy to get back to reading. That is a very different time frame and trajectory than a typical kid who couldn't learn by 3rd grade and the elementary school gives up on him because there's no other reason to explain. He just has an LD, right? So the kids with epilepsy, especially then with all the treatments, they're on a very different trajectory, and we don't always know that it's a no-go on the same time frames as a typically developing child. I just want to pause there. Does that make sense? Because I feel like that's really important. I can't see you people.
Yeah, I don't have any particular questions about
Okay.
this. So when we get to the Q&A, if this is a very important point, I agree. So if anyone is confused about what Dr. Burl is stating right now, let's circle back to it. There was a question in the chat that I wanted to bring up now, which was, are there certain tests that specifically focus on executive functioning at a higher level that are appropriate at the high school level, targeting areas not just of independent living, but also cognitive functioning for study skills and job skills? And I will say I have a 20-year-old, and I underestimated the importance of this set of skills, the executive function skills, which if you're not aware of what those are, we're going to have another power hour in June, but that's initiating, planning, organizing. It's basically adulting. So the question for you, Dr. Burl, is what are the measures or tests that you would use to assess these specific skill sets?
So we do have many of those measures, and they do go into adulthood, and a lot of them do capture the difficulties. But I also have kids that pass them with flying colors, because when they see me, they're alone in a quiet room, one-on-one. I'm being nice to them, and I'm giving them very clear directions, and they do fine. But that does not mean they're going to do fine in a group setting with unclear expectations and have to figure it out. And so that's where parent report really comes into play, where I work, they're actually famous for the parent report. It's called the behavior, the brief, the behavior inventory. I can't believe I can't remember what the brief stands for. Behavior regulation inventory of executive functioning. Behavior rating inventory of executive function. That is so terrible. I could get fired right now on the spot. But anyway, so that gives you more of a sense, and we get that information from different reporters. So not only from you, the parent, but also the child, as well as their teachers and other people in their environment. So the other thing about neuropsychological evaluation, I will say, is that it's not just tests. Tests don't tell you everything. They're fully imperfect, and a good neuropsychologist knows that. So when you have to do all those forms and you're filling things out, that's why we need that context of what their scores are, in their life. And so I'll talk a little bit more about some other assessments that can happen and part of this transition plan. So the psychological data does look at executive functioning, but sometimes we miss, especially for those higher functioning kids. And so we do have to think about that. So it's, again, the timing of it, it's never too soon to start thinking about your transition plan. It's actually required by a certain age in all states. Some require it by 14, others by 16. Best practices will tell you you should start around 12 and 13. And again, it's with the kids that typically have epilepsy or often tend to be a little more complicated because there's medical needs as well as adaptive, social, emotional, and cognitive. If you have all of that going on, then you want to start this early. And remember, it's a process and takes time. So you want to start thinking about it, and we'll go through the assessments. One of the best and most reasonable decisions to give your child, to do, is to give your child more time. So a lot of people don't know that you can do a diploma track high school education in 5 years. You don't have to do it in 4 years. You can do it in 5. You can do it in 6. And most of the time, most of the kids that I work with, that's the best thing you can do, is give them more time. They don't have to do all 7 classes in one semester. Have them do some other things. That's one of the things that are so hard. They're trying to be social. They're trying to do their cognitive. They can't squeeze it in the 4 years, the normal time. So it is a very reasonable accommodation to just prolong their high school education by a year or two. And allow that. Maybe that means taking algebra twice, sometimes it means doing it over the summer and then, finishing up. So thinking about just taking more time is a pretty easy one. The maximum time for education, I think for most, I did see someone say that maybe their state allows to 24. I haven't seen that. It's usually until age 22, so all the way through 21. So readiness, how do you assess readiness? Well, what are you going to be ready for? So what are those options after high school? We have normal post-secondary education like college. You have vocational education. So maybe your kiddo can learn how to fix a car or learn, computer skills. That it's a very specific education. Integrated employment means they're going to be supported while they get their first job, and work on it with help. Continuing in adult education. So maybe it's not in a formal program, but there's all sorts of early education certificates, things like that, where they can be, an assistant in the classroom, or a nursing assistant, CNA, those kinds of things. Those are usually through continuing adult education programs. Or are they going to be in adult services where they really are getting programming similar to maybe what they've had in high school already, for exposure, social exposure, some learning activities, outings, that kind of thing? That's really adult services. Are they going to be living independently or doing some community living, that kind of thing, or community participation? Those are all options after school. The range of assessments. So these questionnaires by you, the students themselves and the teachers are really important. Back to the question we had before. Sometimes they're focused on what are the goals of the child. That's not necessarily in the neuropsych evaluation. So the transition team, the IEP team, actually, I think most part address this. Some do it better than others, but what is really a realistic goal? You know, being an NHL hockey player is not realistic for a lot of people. So it really shouldn't be the long-term career goal of our IDD kids either. So what is a realistic within their range? It can be a stretch, but what is something they could do? What are their areas of interest? Everybody's going to work harder towards something they like. And this should be updated because kids change just as like we all do. We all change in what we like and what we think we want to do. So that should be updated. Student skills and aptitudes, again, school data, the neuropsych data, how they do on tests. These really are informative, again, from the strengths-based assessment, but also they pinpoint those areas of what needs to be developed in order for them to reach that long-term career goal. So if they really do need to read at a certain level in order to do what their job is, we probably shouldn't give up on their reading goals or make it very specific, or they need to be able to use technology to read, which is really great, in order to get that job. So what is it that they would need to work on now in order to prepare them for that long-term career? Situational experiences and community-based is another way to really understand what is going to fall apart. So like I said, I can have a kid look pretty good in my individual one-on-one assessment and even pass all my tests, and they've been very well supported in school and at home. So even on parent report, they don't look bad. But oh my gosh, the first time they went to work, it is like not happening and it's not a good good experience. But you don't know that until they try. So getting them those situational experiences is an assessment. Let's see what happens when they're in a job. You can obviously give them supports, but it's a different environment. Hands-on work experience to see what they like. That also helps. What you learn in school is not always what you do in the real world for a job. And it gives more information than what's on a test. I want to leave time for more questions, but basically really important is self-determination skills. That should be a goal in your IEP by the time you're in the time period of transition planning. These are the set of skills that are needed to believe you can control your own destiny. A big part of self-determination is self-advocacy. If your child doesn't speak up for themselves in some capacity, again, I know it's limited for some kids, they're not going to be able to have these, the repertoire of self-determination skills. It's making choices, learning to effectively solve problems, being responsible for your life. It means experiencing the consequences of making choices. So it's okay if part of this assessment and learning is failing, right? We know that if we don't let our kids fail, any of our kids, some of the best learning experiences are from those failures. They need to understand the consequences of their choices. And so this is sometimes really hard for us with our IDD kids or our high needs kids, because we've done so much for them, but it's really something, don't wait till the end. It's a longer fall if you wait till the end and they think everything's going, great. And it's the first time they've failed at 18. So build that in. Again, it includes these self-advocacy skills, making choices, start with small things, pick a class, pick a sport, pick what you want to do. Have them figure out what dinner is for once a week, those kinds of things. You can start really small, but you start growing those skills. They definitely need to be active in their IEP meetings at some point. They need to know what their neuropsychological profile is. They should be in on those feedbacks. If they have a diagnosis, they should know it. All right, other tips, how do you build independence? All of these things. I know they sound maybe straightforward, but they do take time, they do take effort. Communication is the biggest. How does your child communicate best? They need to practice it. Sometimes it's hard to talk about yourself, and so they need to practice that. Self-care skills, building a schedule. Do they need a visual schedule? How do they ask for help? How do they ask for a break? Do they know how? Community safety for sure. I think we think about that a lot already. Household chores is part of building independence. Having fun, choosing what you like to do is also part of independence. Money skills and vocational skills. Again, I think we think of those. It's a process. There's a lot to it. Give yourself time and extend it as needed. You don't have to make a decision other than that 18 release of information, but give yourself, time to make these decisions. And I just want to point out, this is work from Nico. He's 17 years old. He has focal epilepsy, autism. He's an artist, obviously. He's a small business owner. He does his own landscaping business around the neighborhood, and he's a cozy specialist. He knows how to build little places that are cozy in their house, or a fire pit or whatever. He puts all the things together to make a cozy space. And so there are lots of things I can't do in a neuropsych eval, and that you as a parent have to help bring to the neuropsych eval. But I think this is a talented guy, and on some pieces of paper he may not look it. And I think that's the really important thing, is in that transition plan, it's very comprehensive, and it's your child and how you help them represent themselves. Thank you.
Thank you so much. That was wonderful. I don't know if anyone wants to unmute and ask questions. Just a reminder, we're still recording, so please keep your questions confidential, or you can throw anything else in the chat. I just want to circle back about the brief two, because there was a question that basically said, is there a better parent report than the brief two? I feel like it does not pinpoint my daughter's executive function issues enough, and I filled it out endlessly, which I can completely relate to. And my response was that there always needs to be multiple measures used, and the brief alone would be really insufficient. And also that at transition age, they really should be assessed in real life settings. So this doesn't really apply to the neuropsychological evaluation, but you might be looking at a functional vocational evaluation or another evaluation where they're taking the child into settings that they will be in adulthood and looking at their functioning there. So do you have any other comments about a substitute for the brief, or anything else about really gathering that executive functioning data for our young adults?
So yeah, I mean, as far as like a measure's probably going to be limited no matter what. If the brief is, I mean, there's other executive functioning measures, but I think they're pretty similar. So it does make me wonder, what is it not capturing? That is it because it's school based, or is there some other area that it's coming out? And that's, again, a part of an evaluation is more than just the test. So explaining what is happening in terms of my evaluation, if my numbers aren't matching up to what the parent is saying, that's part of the evaluation. So I may not rely on a measure to tell me that.
Yeah. I think one of the things we spoke about before we started today is, if we could leave you all with anything, it's, why do you need a neuropsychological evaluation at transition age, in addition to a psychoeducational evaluation and all of the other evaluations your child might need? And it's because, exactly what Dr. Burrell said, you need someone who understands the underlying brain basis of the disorder, like hemispherectomy, epilepsy surgery, epilepsy, whatever it is. And you're speaking to how long the child needs to recover and extending the runway and things that a school psychologist who probably doesn't even know anything about epilepsy surgery is not going to be able to address. So is there anything you would add in terms of like the importance of that neuropsych at this age? And because I have a lot of families that are like, well, we had the psychoed, we don't really need the neuropsych, or what value is it going to add, I guess, because, all these tests, they take a toll on our kids as well. And sometimes our pocketbooks and sometimes just our fatigue and stress level. So I think it's quite valuable, but what do you have to say there?
So, I mean, the biggest thing is a neuropsychologist, in like the evaluation, again, the numbers and the tests and that kind of thing, but that it is a professional in a different way than the school personnel. Like I said at the beginning, we've been trained to understand the brain. So that developmental piece, and there's more to the brain than just an IQ and academics. Our brain actually is not developed to read. That's something we put on ourselves. If you put a baby in with a bunch of people, they don't spontaneously learn to read, but we do spontaneously learn to talk if we're with other people. So our brain is actually wired to talk.
Yeah.
So there's different skills in the brain, like language, memory, and motor functioning that we're gonna do whether we went to school or not. And so those tend to be the other skills that the neuropsych can help you with, of why then you're not maybe doing the reading, writing, math. And then the life skills too. So I think that's the other piece that we bring to it. It's the other domains, but also the other understanding of what the brain is sort of naturally meant to do, along with the impact of disease, treatments, those kinds of things.
I think also the recommendations for timing, interventions, et cetera, because I think what I see in the school psychology evaluations is they'll do testing measures, they'll do observations, and they have an opinion, but then there generally aren't any recommendations. So if you look at your school-based reports, they rarely contain recommendations, and they'll say the IEP team will decide what to do with this information. And it's not helpful to families because we need a roadmap. And that repeated neuropsychological evaluation becomes the roadmap that helps drive services and drives the longer runway or whatever it is that the individual needs. Monica posted in the chat that this summer at our conference, which I put the link in, we're going to have sessions on guardianship and supported decision-making. Just note that what Dr. Burl described between guardianship and conservatorship, it is different in every state. So the terms might be entirely different. So you just want to find out what it is in your state. So if we're in California, you can't get guardianship unless the child's incarcerated. The parents are incarcerated, but you can get conservatorship, and there's a range of different levels of conservatorship, limited or full conservatorship, et cetera. So we'll be talking about that at our conference this summer. And we have tons of resources on our website. We have our transition course and guide and whatnot. I'm hoping we can embed this in our transition course, Dr. Burl, if you'd be willing. Monica's raising her hand. Yeah, go ahead, Monica.
Yeah, I just wanted to make a quick comment. We have done here at the Pediatric Epilepsy Surgery Alliance, formerly the Brain Recovery Project, some studies in adults who had hemispherectomy surgery in childhood. And this portion of the study is not yet published, but everyone, regardless of what type of surgery your child had, be very careful with their naivete. It's something that we see across the board with the neuropsychological assessments that we've done in the adults, even those who seem to be doing, quote unquote, very well as adults, they really have a very challenging time with naivete. And that can open them up to sexual abuse and financial abuse and other types of abuse. So definitely flag that, in my opinion, when you are having these neuropsychological evaluations that are determining transition. Make sure the neuropsychologist is really assessing their naivete.
Yeah, 100% agree. There was one more question in the chat, and maybe this will be our final question, and it's how do I find a neuropsychologist that will conduct the most helpful evaluation? We've had a few done, but the doctors did not have much experience with other hemispherectomy kids, but I don't know what I don't know. What questions can I ask to vet the next evaluator?
So definitely asking if they've evaluated kids with hemispherectomy is a good question. Even then, even though it's rare, like, do they even know epilepsy? Most centers that do the surgery are gonna have the neuropsychologist, so I think it's worth the trip back to that
Mhm.
location, if you can. And then the other sort of most I guess the ABAP, the board certification in clinical neuropsychology is at least they've gone through the rigor of the board process. And you're not required to do that to call yourself a neuropsychologist even,
Mhm.
but if you're board certified, it doesn't mean you're specific to epilepsy, but you've at least, those are the ABPP letters after my name. At least tells you they've been tested on that in a rigorous way. And I would trust one of those people because they at least know the brain. And
Mhm.
if they're a pediatric specialist would be the other piece.
Yeah.
I don't believe the people too much anymore that say they can do kids and adults. There's some older, more experienced people that still do that. I do think a pediatric person is going to help you a little bit.
Mhm.
And
Mhm.
they're going to, sometimes the adult folks don't really understand all that your child has been through, like the journey there. So it's not always true, but those are some generalities, I would say.
I would agree. And Monica had put in the chat that she'd encourage the parent to go to the hospital where your child had the surgery or your nearest big hemispherectomy center.
Mm.
So with that, I'm going to say thank you. And this was just better than I imagined. And I hope everyone else got as much out of it as I did. And it will be posted on our YouTube channel soon. And we'd love to have you back again to speak about
Yeah,
another topic in the future.
great. I hope it was helpful. Thank you.
Thank you.